Hello, this is Margie Meady, and I'm recording the PowerPoint about anger and aggression management for the Psychiatric Mental Health Nursing course. And it's important for us to know that anger doesn't necessarily have to be a negative expression. It's a normal human emotion, and if we handle it appropriately and express it appropriately and even assertively, we can provide an individual with a positive way to solve their problems and make decisions about life situations. Anger only becomes a problem when it's not expressed or when it's expressed aggressively versus assertively. So in this presentation, we're going to talk about the concepts of anger and aggression and the predisposing factors that lead to a maladaptive expression of anger. And then, of course, the nursing process will be used to discuss how we assist clients in the management of their anger and/or aggression. So this slide goes over the difference between anger and aggression. And anger is an emotional state, and it can have various amounts of intensity. It can be simply mild irritation to very intense fury and rage. It can cause physiologic changes that you would notice in the body's responses, increased heart rate, blood pressure, and levels of biogenic amines. It's not a primary emotion. That's an important thing to understand. It's a learned emotion. And it's typically experienced as an automatic reaction to either hurt, frustration, or fear. Fear is a really important thing to understand, especially when we're taking care of patients. When we think about the fact that often their angry outbursts are from the source is fear, that helps us not internalize their anger and take it personal when we're dealing with people. And a lot of times people are very fearful when we're caring for them. It's a physiological arousal, and it does instill feelings of power, and it helps our body prepare to respond to a threat or a situation. And it's very different from aggression. So if we understand that anger doesn't necessarily mean somebody is going to be aggressive, that's an important thing to keep in mind as well. Anger is capable of being under our personal control. That's another important factor. And it can have positive and negative function. That's another really important thing to keep in mind. It can mobilize us to act, and it can mobilize us to act in a positive way, but it can mobilize us to act in a negative way. So aggression is a way that some individuals express their anger. It's a behavior that is always intended to injure the victim's security or self-esteem by various mechanisms, either words, fists, or weapons. And again, the underlying intention is to punish the person that we're being aggressive towards. So this is a really important thing for us to understand, that this is part of what we're going to be exposed to when we practice in the professional arena. And I think that many of you will probably encounter trainings that you will participate in order to help you deal with de-escalating anger or aggression in the workplace. I did put this as one of our assignments for this course to help you understand that it is something that is something you will encounter in your professional practice. I'm actually involved right now with trying to establish a training for the college employees here in Kodiak to be exposed to some ways to de-escalate people's emotions of anger. And I think that it's, as people are strained with different life challenges, it becomes something that's even more important to know that we might come across it in our daily life out in the community as well as in our professional life. So predisposing factors, it's really interesting that modeling is one of the strongest forms of learning, and that means that what we see modeled or represented as we're growing up as children, that is the way we learn how to incorporate that behavior into our life. So if we're growing up and we see that it's very appropriate to respond to frustration and challenges but with anger and outbursts and aggression, then we know that that's the way we're going to model that behavior as we become adults. So role models can be positive or negative. So our caregivers, our primary caregivers, our parents or whoever raised us, are the ones that model how we learn to respond to our emotions. So again, it's typically our parents that can teach us to positively or negatively handle our emotions and express our anger. But as a child gets older, then they are more likely to be influenced by peers or celebrities, and they're more likely to emulate the behavior that they see from people that they respect or idolize. So operant conditioning is a specific behavior that can be positively or negatively reinforced. So positive reinforcement obviously is when we're responding to a behavior that is pleasurable or producing desired results, whereas negative reinforcement is a response to a specific behavior that prevents an undesirable result. And anger and aggression can both be learned through operant conditioning. Neurophysiologic disorders are implicated in aggression and violent behavior. So you can have temporal or frontal lobe epilepsy be implicated in the expression of anger or aggression. Brain tumors, brain trauma, or encephalitis, all of these things can be the mechanism or the source that has been the trigger for somebody's behavior of aggression or anger. So here are some other predisposing factors. There could be biochemical factors where the aggressive behavior is connected to some sort of alteration in chemicals in the brain. It could be a hormonal dysfunction, particularly hyperthyroidism is associated with, is a condition that is associated with aggressive behavior due to the high levels of thyroid hormone. It could be alterations in neurotransmitters such as epinephrine, norepinephrine, dopamine, acetylcholine, or serotonin, because these chemicals play a role in facilitating or inhibiting our anger. It could be a socioeconomic factor. There's a higher rate of violence related to poverty in the United States because those people are living in conditions of deprivation, their families are disrupted, and they have unemployment. All of those things can be triggers to anger and aggression because of the stress that accompanies those conditions. Could be environmental factors. Anger and aggression are associated with an increase with physical crowding of people that's a stressful situation to deal with, or when they have discomfort because of even an elevated temperature. So when there's a heat wave in inner cities, for example, that have a higher population, they see an increase in crimes and assaults. And alcohol and other drugs such as cocaine, amphetamines, hallucinogens, and anabolic steroids have all been linked to anger and aggression. And then availability of firearms is a predisposing factor to aggression, being the result of anger. So this slide just lists all of the characteristics that could be observed when somebody is becoming angry. I won't read the list for you, but you can kind of see that it's very easy to determine when somebody's becoming angry by thinking about these list of characteristics. It's important for you to be comfortable and familiar with identifying them if you see them escalating in your patient, or you're noticing them or assessing them in your patient, because then you realize that you need to incorporate some actions to de-escalate or minimize those feelings, to address those feelings before they ramp up to an outburst of aggression. So here, now we've kind of ramped up and the person is moving from anger to aggression, and these are the characteristics that you can now identify. So be aware if you see somebody that's starting to pace around or seems restless, or they have very tense, clenched body parts, clenched fists, tight shoulders and neck, hunched over, they're verbally or physically threatening, punching the wall, angry, raised voice, loud voice, shouting, use of obscenities. They're arguing with everything that's being presented to them, becoming more agitated, seeming to overreact to every little thing. So these are the things to be aware of and be responsive to when you notice them in your patients. And you can see I've put a picture here that's kind of showing some of these responses. So if you get an exam question or you're in the clinical unit with a patient and you see any of these things happening, you need to alert people that this is what you're concerned about, this elevation to an outburst of physical aggression. And so if it was described in an exam question, then it would be that you would identify that this person is at risk for physical aggression. And this slide is pointing out that prevention is the key. So as I mentioned in the previous slide, when you identify that anger has progressed to the potential for aggression, that is you identifying that problem or that potential, that risk for occurring, and then you want to step in and try to prevent it. So some other ways to identify the extent of how likely it is to escalate into an aggression or a physical attack is that whether the client had a past history of violence. That's considered the most widely recognized risk factor for violence in a treatment setting. So you want to highlight that in your notes, that if somebody has a previous history of violence, that you don't take any chances in responding. So, for example, in the hospital setting, well, we were very reluctant to document when somebody seemed aggressive or hostile to us in that setting. We just were kind of saying, well, they're stressed, they're fearful, they're in an unfamiliar environment, and nobody documented that they threatened them, that the patient or client threatened them or was overreactive to the situation. And we know that if they're likely to do it in one instance, they're likely to do it in another instance. So if we document that and fill out a report, it's another step to document that behavior, but it gets put on the patient's record, and then future providers are aware that that is part of their previous history because of this statement on this slide, that a past history of violence is considered the most widely recognized risk factor. So if you're going to go take care of a patient and their chart comes up, their electronic chart comes up with that alert on it, then you can be prepared to be observant for this potential in the interaction you're going to have with that client. Client diagnosis, commonly, what's the type of diagnoses that are commonly associated with violence include what I have listed here: substance use disorders, schizophrenia, major depression, bipolar disorder, neurocognitive disorders, antisocial, borderline, and intermittent explosive personality disorders. So seeing these disorders on the client chart would alert you to the fact that there's a risk for aggressive, violent behavior. And then their current behavior, of course. The behaviors that you're actually observing in the moment could alert you to the fact that they could be at risk for having an angry outburst. So these are called the prodromal syndrome. And again, I've listed them here for you. I won't read them to you, but you can kind of highlight this in your notes as well, because if they were described to you or you were to witness them, then you need to be aware that this patient or client is at risk for escalating into an aggressive, assaultive type of behavior. So some of the nursing diagnoses that we might identify for someone that inappropriately expresses their anger or demonstrates aggressive behavior includes complicated grieving if the anger is related to a loss, ineffective coping, or risk for self-directed or other directed violence. So self-directed meaning they're going to hurt themselves or they're going to hurt somebody else because of this aggressive behavior. So for example, they could punch the wall and break their hand, or they could punch a family member. Or they could throw something that could injure somebody. So these are the outcome behaviors that would then be identified as the criteria for evaluation. So important to highlight these techniques in your notes as well. These are the ways you would deal with somebody that you identified as being angry. Trying to remain calm, not to internalize their anger. Their anger is usually not directed at you, but it can become directed at you if you take their emotions personally. You do want to set verbal limits on their behavior and keep a diary, help them to keep a diary of their anger. If you're working with them as a client on an inpatient setting, that would be one of the things that you might recommend that they do. You would avoid touching the client. Highlight that in your notes as well. You never want to touch somebody that seems angry. Usually we think of holding someone's hand or putting a calming hand on their shoulder as something that is helpful. We often talk about therapeutic touch. This is not the time that we would use touch as a therapeutic intervention. Not. So highlight that in your notes. Help them to determine the source of their anger so that they realize what this emotion is stemming from, and that it's not something that you were involved with, that it came from another source. Ignore derogatory remarks. Again, they're not directed at you. Don't take them personally. They're just venting their emotions at this time. So don't respond or react. Help them find alternative ways to release their tension, and role model, the calm, quiet voice is something that you're trying to get them to emulate. Observe for their anger to start escalating, and if those behaviors are observed, ensure that there is sufficient staff available. So again, you do not wait to call for reinforcements or backup. As soon as you notice that something seems to be escalating, there's ways that you will be taught on the unit to signal for others to come to your aid. And again, one of the things that you always know is that you never have that patient be between you and the door, or the client be between you and the door. You always have a route of escape from being in the presence of that person, and you should always have a way to signal for backup. So that's the important points of this slide. So this slide talks about the techniques for dealing with aggression. These are our nursing interventions that we're going to implement. Talking the patient down from their anger, physical outlets, giving them something that they can do to physically release their anger appropriately. Medications, calling for assistance. Sometimes we might need to resort to restraint. Sometimes it's just observing and documenting and providing ongoing assessment. And then after something would occur, then there would be a staff debriefing. So talking down might be enough. Medications or restraints might need to be implemented, and when those things escalate to a significant intervention like that, the debriefing is appropriate for staff to do, because they want to make sure that they didn't respond in too aggressive of a way with that patient, or that they didn't, and if they didn't escalate and get staff on board and help arrive in time and things got out of control, then they would want to debrief about why they didn't get things moving faster. So it's really a good idea to debrief how any kind of a situation was handled, to say, yes, we implemented all the right steps at all the right times, and we handled this event appropriately, or I think we should have called for reinforcements quicker, or I didn't recognize the signs fast enough. Those sorts of things. So a lot of times these interventions also have protocols or procedures that you would follow for, when is it appropriate to give a medication when the patient is refusing it? When is it appropriate to put restraints on a patient? All of those things. I'm not going to get into detail about those particular things on this slide, but realize that you do have policies and procedures in place for when to implement these things. And again, you would debrief to see if those policies were followed appropriately. So here are some questions to practice implementing the content of this PowerPoint. So a client has not received what was expected for lunch and directs an angry verbal outburst at the nurse. Which is an accurate description of this display of emotion? So go ahead and pause it, and then I will give you the answer. So the correct answer is C. The expression of anger can come under personal control and is a learned behavior. Another example question. After repeated requests for a client to unpack and get settled on the psychiatric unit, the client states, I have no intention of unpacking and staying on this unit. To avoid a confrontation, the nurse unpacks the client's belongings. Which nursing behavior is exemplified? And you can pause it. And the correct answer is B. This situation illustrates negative operant conditioning. The client's negative behavior has been reinforced and rewarded by the nurse's action of unpacking for the client. So in the future, when the nurse requests that the client do something that complies with their treatment plan, the patient realizes that they can refuse and somebody will do it for them. So same thing with parenting and children. You know, you tell a child to stop throwing their ball against the wall and they don't do it and you ignore it and there's no consequences, then that becomes, you know, that negative behavior has then been reinforced. An angry client states to the nurse, "You red-headed, skinny witch, you can't tell me what to do." Which appropriate intervention would the nurse implement during this outburst? So go ahead and pause it and read over the options. And the correct answer is D. During expressions of anger and aggression, ignoring initial derogatory remarks can be an appropriate nursing intervention. Lack of feedback often extinguishes an undesirable behavior. So I hope you found this PowerPoint beneficial, and thank you very much for your time and attention.